My name is Winella, and I've had trigeminal neuralgia for just over 4 years. It's come and gone 3 times during that time. The very first time is when I had the worst symptoms, and so it sounds like a shocking pain from your mouth, clear down from your chin, clear up. It feels like the whole side of your face. Mine was on the right side only, but I couldn't bite anything, I couldn't smile, I couldn't anything. I felt like I couldn't do anything. I couldn't talk right. Certain sounds would make it go off, and I'm a teacher, so that's a problem. Even the wind sometimes, or the cold would set it off. So you're always afraid. If you're not in pain, you're afraid you're going to get the pain. And so it was very hard to talk or communicate. I had to take, I think it was a week or more off of work, and even then when I went back it was hard to do my job, and all I did was go home and sit and not do anything else the whole time. Yeah, so it was hard to even talk to anybody. That would set off the pain. The smiling, giving hugs, because if you notice when you hug people, it's always on their right side, and if they hit it, it would hurt. So I couldn't play with my grandkids very, very much. I couldn't even smile or kiss my husband would hurt. So it just affects your life in every aspect. So as I said, I've had it 3 times. The first time was really bad, and it finally went away with medication. The second time wasn't very severe, and then the third time I could feel it coming back, so I started taking the medicine again, and even at the highest dose of medicine it was still getting worse and worse, and I just couldn't take it anymore. So my husband and my sister-in-law actually were the ones that started researching alternative methods, because the neurologist just says this is all we can do. You can take this much medicine and then that's about all we can do. You just have to wait till it goes away or live with it. And so they started researching, and my sister-in-law sent a video that we found from a dentist in Oregon that this girl described her symptoms, and they were way worse than mine. Like, she had it on both sides and a lot worse, and I thought, well, yeah, it helped her, but she was so bad anyway that, I don't know if I need to look into that, or mine will just go away like it always has. But then it kept getting worse and worse, and so I find that there was one day I just couldn't take it anymore, so I sat down and watched the whole video of her, and then I started looking up more videos, and there is a few. I think they were all from the same doctor, and so but they just said DTR. So first I looked up what is DTR, which is disclusion time reduction, and so then I looked that up, and I thought, I wonder if there's anything in Utah. Like, I thought maybe Salt Lake would be fine. At this point I was ready to go to Oregon, because it's like, if that can help, I'll go to Oregon. And so I was pleasantly surprised that there was one here in Roy, Utah, Dr. Whitaker, and I just started crying when I saw that it was that close, and I called them, and they got me right in. Like, it was on a Thursday. I couldn't go the next day. They said we can do Monday. I was like, yep, I'm in. So that's how I found out about it. So the first appointment was just like a diagnostic, and I'm not gonna lie, that was very painful, because I had to open my mouth. They did x-rays, they did everything. It was a little painful. But then the first one was a treatment, and they come and they put the thing in your mouth and you bite, and they adjusted the bite, and it started getting better. But I was still very skeptical, because when you live with this kind of pain, it's like, yeah, it works for now, but it's not good. It's getting a little bit better, but it's still there, so I don't know. And then after the second treatment, it seemed to get worse. Like, I could feel, but I could kind of tell that it was from the bite that was worse. So I called up, and they were really good to get me back in. And then the third treatment, it started getting even better, and I was like, okay, maybe it's going to work. And then after the 4th treatment, it was like instant almost. I felt it was gone. I didn't have any more shocks, because even when it wasn't painful, I'd have little shocks, is what I called them. But I didn't have any more, and I haven't had them. And so I'm very hopeful. And I started coming off my medicine. I'm at a very low dose compared to what I was taking then.